Hello, everyone. This is Dr. Lynn Toohey with NutriWest, and I'm so glad that you were able to join us today on April 13th for this webinar with Dr. Brandon Lundell. I have the honor of introducing him today. He's a very highly respected and very experienced doctor, and he is here to share some very valuable support information for all you practitioners out there who are trying to help patients in these stressful times. I can.
Okay, great. And you can see my screen started. Welcome to the webinar today, everybody. We've got a lot of information to cover, and we've only got an hour, so we're not going to be able to cover an extremely comprehensive viral support. But I want to present a lot of information that maybe you haven't had already, maybe you haven't seen. There's obviously a lot of information going around, and everyone has more time, a little bit more time to try to sift through that information. So I want to present some stuff today that is a little different than you might have seen before, and some pretty exciting stuff to help with our patients. There's a lot of new information coming out, and it's very difficult to sift through what might be helpful and what isn't. So I've done a lot of that for you today. Obviously, the disclaimer here, we have to be very clear that we're not diagnosing, treating, or curing any disease, especially what's going around right now. What I want to present today is some scientific information that we can use clinically to support our patients, however they're presenting with different viral presentations. So just keep in mind that we might have to be a little tongue-in-cheek today, but we'll keep it clear what's clinically relevant and what isn't. So I'm going to go over some overall information on viral immunity and give you also some clinical, empirical, and scientific evidence of how nutrition affects our immune system very specifically and very, very appropriately for what we're dealing with today. So, and I don't know about all of you, but I'm treating my patients, and I have had some patients that have come down with this current virus, and we've applied these therapies and suggestions. So I'll provide some of those empirical data as well. So I just want to kind of go through a little bit of things that I think might be important. So why death and mortality rates differ greatly. Different reports that we're seeing today, everywhere from New Zealand having a death rate of 0.3% to Italy and China, above 10%. So this is a really good article if anyone wants to look at the nuances and the complexities of deciphering what real death rates are. And it's not easy, especially with a lack of testing. But this is a great article summarizing. It's not just the lack of testing that's the difficulty. It is there's a lot of different confounding factors. So we know during an epidemic, this is Hannigan, who's a researcher at Johns Hopkins, I believe. But she says, we know during an epidemic that people will call every death as though it's related to COVID-19, but that is not always the case. So it's interesting because when we look back at other pandemics, such as the H1N1 and the original swine flu or the original SARS back in 2003, the early case fatality rates were always inflated by a factor of more than 10. It's kind of interesting. Even 10 weeks into that epidemic, estimates varied widely between countries, coming in between 0.1 and 5.1. So very similar to what we're experiencing now. But when the medics later had a chance to go through case documents and evaluate all the cases, the actual death rate was actually 0.02%. Now, I'm not saying that this current epidemic is going to be 0.02% by any means, but there are the denominator of people who actually have it and haven't been tested are not counted in the total death rate. So, so death rates, the people who are trying to factor this in based on regression models of past pandemics and things, are going to come in at around 0.5% for the general population. Now, obviously, over 65, 85 to 90% of people who are dying are over 65, so we'll get into that. And most of those actually are males, interestingly enough, so we'll talk about the sex differences as well, why males seem to be more more susceptible than females. So, there's a lot of confounding factors, but I just wanted to present that because there's a lot of misinformation about death rates, and this isn't to say take this any less seriously by any means. It's not to take away from the seriousness of this, but we want science. We want good data so that we can make appropriate choices. So and so we'll go into some things that we can do genetically and also nutritionally, epigenetically, that can affect that as well. So genetic susceptibility, we're going to see a lot of more of this in the next year or so. So what are some of the genetic things that might make people more susceptible to viral infections and more susceptible to serious viral infections? One here, glucose 6-phosphate dehydrogenase deficiencies. So people who have the G6PD enzyme deficiency seem to be very much more affected and have a much more serious course of viral diseases. So what this means is that, and what this shows is that people with redox, so antioxidant capacity deficiencies, seem to be more at risk for a more serious course, more infection, and a more serious course of the disease. So looking at redox and supporting redox capability before infection, and indeed after infection, if that's the case, is really, really, really important. So G6PD is part of making glutathione and making antioxidants and the other thiol molecules that are really, really important in protecting cells, specifically pulmonary, all cells, but pulmonary and cardiovascular, which are the two cells types that seem to be more susceptible because of the angiotensin converting enzyme receptor, and that's the receptor that this this current virus is attacking. Well, most coronaviruses attack that. So also genetic expression of that ACE receptor. So we're seeing people who are more likely to have high blood pressure have a genetic susceptibility or genetic predisposition to making more of that receptor. And that receptor is how the virus gains entry into the cell. So if you genetically are expressing more of that receptor, you not only have a greater likelihood of having high blood pressure and cardiovascular disease, because it has an effect on that and also on the kidneys, but it also makes you more susceptible to viral infiltration. So that's a genetic thing. But then, unfortunately, people are put on high blood pressure medications. Now, what happens is when you're put on a high blood pressure medication, specifically an ACE inhibitor, what happens is the body actually will express more of that receptor. I hope that makes sense. But when you're put on something that blocks a receptor, a drug that blocks a receptor, the body will respond by making more of that receptor, which is why we see clinically that high blood pressure medications often work for a few months and then they need to increase the dose. So that's very important because people on high blood pressure medication we're seeing at a much higher risk for developing a serious course and more more chance of infection. So that's also a very important genetic point. But this redox capability can predict course of infection. So it's quite interesting. A lot of some study, this is an interesting study too on the Middle East respiratory syndrome, which happened a few years back, and they're just looking at some of the genetics that are involved, and indeed it's very similar to what we're dealing with now. So especially with airway genetics and redox capability. So again, the ability of the body to be able to modulate inflammation through NF-kappa B and NRF2 and glutathione recycling. It's all very important. So, we'll get to that too in a little bit. So redox genetics, again, cell entry by enveloped viruses, redox considerations for different viruses. And again, this is another study showing that if you have redox changes and you're not able to have enough glutathione and recycle the glutathione, then lungs are going to be more acidic and it's going to be more more viral interactions and more viral replication. So all very, very interesting stuff that that we want to be aware of. And we're all trying to look for answers. We're all trying to look for things that can help. We have to use, in the absence of placebo-controlled randomized trials that can take years, we have to use the evidence that we have, especially if those treatments aren't harmful. But unfortunately, a lot of treatments that people are, non-nutritional treatments and pharmacological treatments that people are promoting have a lot of serious harm. For instance, hydroxychloroquine actually creates retinal damage, and it can create long-term immune deficiencies. And so, we don't want to be using things lightly. We want to use the current evidence. And what I'm presenting today is the fact that we have a lot of evidence that nutrition helps with viral support, and the risks of taking these there's very low risk profile in these. So we want to use what we have and what we know. So let's look at nutrition and immune activity. In this study here, this is the enzyme, and we're going to use a couple studies that use other retroviruses, but also use the same ACE inhibitor enzyme. So we know that the mechanism of action is very similar, because a lot of viruses, the SARS virus does attack this ACE angiotensin converting enzyme too. So here they looked at different retroviruses that are pseudotyped and can be used for studies. So in this study, they looked at one of those pseudotypes of the SARS, which is a murine retrovirus. So in this, prevention of immune dysfunction and vitamin E loss by DHEA and melatonin. This is a great study showing the combination of DHEA and melatonin having a dramatic effect on the ability of the body to deal with viruses. So this is a great graph here. So I'll explain it. In this control, so the white bar is the uninfected and the dark bar is the infected individual. So the control group got no treatment, okay? And what we see is that this is the baseline here of B cell proliferation. When most people get infected, their B cell proliferation actually goes down. And that's not a good thing, because that's the antibody producing cells. We want these to go up. Look at what happened with DHEA, both uninfected and infected, which means that you can do this both pre and post infection to increase immune support. Melatonin had a similar effect and similar effect together. Now down here, when we're talking about T cell proliferation, again, this is the ability of the body to kill the infection with the Th1, Th2, Th17, and all those things that you learned about in Dawn's webinar. But we want T cell proliferation. We want T cell activity. We want modulated T cell activity, which we'll get to, but we need T cell activity. And again, in most people, we see that when they get infected, the T cell proliferation goes down initially. And if it stays down, then you're in big trouble. But with DHEA, it increased quite a bit, especially in the infected individuals. But when we combined DHEA and melatonin, we had a dramatic effect. I mean, a six-fold effect on T cell proliferation. This is really, really important. So also looking at people who are, so here's the aging, right? And we'll get into this too. Why are people who are aging more at risk? I mean, there's a lot of factors. Correlation does not mean causation. Old people have less of every biochemical, but we want to hone in on the biochemicals and nutritional factors that give us the best bang for the buck, that do increase the immune system the most. And DHEA and melatonin together seem to be really important. So there's been a lot of stuff going around about melatonin, but I haven't seen a lot going around about DHEA. So I wanted to present this and just to show you how important they are together, to do it together, especially in the elderly who are DHEA and melatonin deficient. So really, really important to do those together. And I'll just present a few other things about melatonin. Its possible role in the management of viral infections, a brief review. This was done back in 2013, so this is not new. We have evidence. We have so much evidence of nutrition's effect on immune system and specifically viral immunity that we shouldn't be guessing. We don't have to guess. We do have this. We do have the evidence. So yes, this is a great study, good review study of how it works. And we know melatonin has many different aspects: regulation of circadian rhythm, immunomodulation, regulation of mitochondrial functions. Now, this is interesting. I don't want to go too much into this, but with mitochondria, what we're seeing is autophagy regulation is really important. The ability of the cell to have proper cleaning mechanisms and proper apoptosis when needed. Melatonin is extremely important in autophagy and mitophagy, and we're seeing that is really a good mechanism of action and at slowing down bioreplication and preserving cell function. So it's anti-inflammatory, antioxidant, anti-excitatory, and here we see the vasomotor. Again, we see that it has an effect on the ACE receptors. So a lot of different mechanisms of action. So of course we have SLP renew. You don't need a lot. 1 milligram, 2 milligrams seems to be an effective dose for most people. So I have treated people with this current virus, several actually, and if they take a turn for the worse, we start with 1 or 2. I started with 1 or 2 milligrams. If they take a turn for the worse, which one elderly person did, I did bump it up to 5 or 6 milligrams, and that seemed to be very helpful. Also with what we're other things that we'll discuss today, but start low. 1 to 2 milligrams seems to be fine, unless it kind of takes a turn for the worse, and then you can go up to 5. Some literature shows 10. So that's really important. So let's talk a little bit more about DHEA and the sex difference in viral responses. Sex hormones regulate innate immune cells and promote sex differences in respiratory virus infection. All viral infections, actually. I think Dawn went into this quite a bit. But we'll talk about how this age and both age and sex difference works together. So we see, I don't want to go too much into this. Again, I think Don went into this a little bit. We see here on the pink side, this is what females are most likely to experience in a respiratory viral infection because they have more estrogen receptors. They tend to increase interferon. They tend to increase specific interleukins, interleukin 1B, and so this is actually a good thing because females are more likely to actually resolve the infection. However, they're more at risk for a cytokine storm, or unregulated cytokines, especially if a woman's hormones are off, if there's not enough progesterone, if there's not enough estrogen, if there's not enough DHEA, or if there's too much, or if there's an imbalance, they're more likely to have that. Whereas males, if there's a hormone deficiency or hormone imbalance, they're more likely to have global problems in their immune system. They're more likely to just succumb to the virus itself because their natural killer cells decrease in number, decrease in activity. Testosterone is extremely important for males to have proper natural killer cell activity. This is why DHEA is so important. And also to modulate interleukins, and specifically interleukin 6, and we'll get to that in a minute. But just to highlight a little bit of different sex differences there, and sure enough, we are actually, well, here's a part of this study too. Sex differences in the incidence of viral infection, especially on the lungs. Here, ovarectomy of females followed by progesterone replacement to luteal phase levels also reduced morbidity on the virus, on the viral infection. So it's kind of interesting. If the progesterone is low, women tend to be more at risk. So progesterone can be very important. And then gonadectomy in young females increased both morbidity and pathology of the viral infection. And replacement of testosterone or DHT reduced morbidity, mortality, and inflammation. So pretty interesting. And also testosterone treatment in older male mice did increase survival. Didn't alter the pathology, but it did increase survival. So that's very, very important as we get going. So, you know, melatonin, DHEA, testosterone, we have all these things that we know specifically affect the immune system. And also, in this study, hyperinflammation, immunosuppression is likely to be beneficial. So we want to support, you know, we want to have proper immune function. But if we do see somebody, now here's a list of labs, and you know, those of you who have heard me speak, I'm all about laboratory medicine. We have to know what we're doing. We have to apply the right therapy to the right patient at the right time, and we have to have laboratory medicine guide us. And no one is doing this. No one is doing this in the hospital that I'm aware of, and it's really too bad, because we have this study here just published a couple weeks ago in the Lancet, looking at factors of comorbidity and mortality. Okay, so if you have a higher temperature, then you're more likely to have mortality. If you have hepatomegaly, splenomegaly, if you have cytopenia, but look, if you have elevated triglycerides, if you have elevated fibrinogen, if you have elevated ferritin, if you have elevated liver enzymes, then, and also CRP is done in another study. If we would just run some of these inflammatory markers, we could see the progression, we could see what level of inflammation, and at that point, then we want to apply some of the antioxidants and anti-inflammatories for that patient. You don't necessarily want to do that in the beginning, and I'll get to what some of those anti-inflammatories are, but that's when you want, you know, the resveratrols, you want the curcumins, you want the, you know, more broad spectrum anti-inflammatories. So just interesting, if you have the chance to run some of these labs on patients, which I have, and you know, CRP does seem to be a very good, you know, it's $30, and it does seem to be a very good marker for disease progression. Cytokine dysregulation and increased oxidation is prevented by DHEA. Again, this is the murine pseudotype, so it acts very similar to this current virus. And DHEA showed a significant increase in certain interleukins, which we want to fight the infection, and it preserved vitamin E levels, which is what preserves cellular function and cellular, you know, so the lungs don't get so damaged that it goes into respiratory failure. So vitamin E actually is really important, but also preserving vitamin E. So you can supplement with vitamin E, and you can preserve vitamin E with DHEA, with N-acetylcysteine, with some other things that I'll talk about. But DHEA was it seems to be very appropriate, because it also suppressed interleukin 6 only if it's high, okay? So it's not gonna suppress it in a normal individual. It's not gonna alter how the immune functions and is supposed to function, because we need the interleukins to fight the infection, specifically IL-6 and TNF-alpha. However, if it goes too far, then that's, you know, that's going to be a problem, and DHEA help modulate that. So DHEA increase the interleukins that we need and decrease the interleukins that we don't need in this model of viral infection. So pretty interesting. Again, another study showing the same thing with DHEA, and DHEA specifically largely prevented the reduction in T cell and B cell. So again, just like we showed in that first, we want proper T cells and B cells. So let's look at the elderly. So respiratory viral infections in the elderly, and again, this study was done in 1999. We have so many good studies, and you know, we don't have to wait for a placebo randomized controlled trial. I mean, that would be nice, but we can't wait. You know, we have to use the best evidence and low side effect profiles. Interestingly enough, among all respiratory viral infections, this current one included 3/4 of all deaths are over the age of 65. This is not new. This is something that we've known, and it's not like throwing us a curve. It's just being more, you know, it's just the rapid spread of it that's making it more highlighted. And interestingly, in this study, though, what they're showing is that they've actually wanted to put DHEA into vaccines, interestingly enough, because it increases post-vaccination antibody titers, specifically in elderly subjects. So I thought that was interesting. And when I came across this study that DHEA has been looked at to actually increase the effectiveness of vaccines. So something to think about when the vaccine does come out, and if you or your patients decide to get that. People with low DHEA tend to have a less response to that vaccine. But also what this shows is that if you do have the infection, we want immunity, we want antibody production, so it can increase your post-infection immunity and globulin levels. Again, this study shows the new coronavirus, or a couple reports appear to take a greater toll on men than women. And now there's some, I'm not saying that these are the final numbers, because what we're seeing is that a lot of times guys, there's some psychological things. Guys tend to just stay at home, Women tend to go to the hospital sooner, and that's known. Guys tend to like stick it out until it's too late. So there's some of that, and so what we're seeing in death rates isn't just sex differences. What we're seeing is, the difference in maybe seeking help at a timely manner. But we do see, even when that is accounted for, it is affecting men, again, because of the lower hormones, because of more comorbidities. Men tend to have more comorbidities. All right, so let's talk about N-acetylcysteine. One of the most powerful things we can do to protect lung tissue. The combination here of ascorbic acid and N-acetylcysteine improve in vitro the function of lymphocytes. So we want to support the lymphocytes. We want to support our immune system. And to do that, the combination of ascorbic acid and N-acetylcysteine, and really it doesn't take a whole lot. We're talking about now, pre-infection, vitamin C doses that I use is 500 milligrams, 4 times a day is about what I shoot for. But the studies show if you get infection, then you want to do 1 gram at least 3 to 4 times a day. So you want to almost double that, and that's what they've done in some of the hospitals. And I've offered, I have done vitamin C IVs too, if you have the ability to do that. But oral seems to be effective as well. We don't have to rely on IV vitamin C, obviously, unless the patient is intubated, on a ventilator, or unable to swallow. That's when IV vitamin C should be employed. So oral vitamin C seems to work really well, especially when it's combined with N-acetylcysteine. N-acetylcysteine a prophylactic dose of maybe 750, and then if you a post-infection dose, probably triple that. So like 3,000 milligrams. N-acetylcysteine protects against, it's been studied against the swine flu, which was several years ago, but it's shown to directly inhibit replication of these seasonal flus and pandemics. The results show that pulmonary inflammation, pulmonary edema, MPO activity, total cells, neutrophils, all of these were attenuated by N-acetylcysteine. So really important to do that. Influenza lung injury, which again, this is the influenza is this model. It's the same type of lung injury, although a slight different pathophysiology, but a very similar one. And N-acetylcysteine's been studied for years and years to protect the pulmonary cells, to protect the epithelium, as well as inhibit viral replication. So really, really important in that. And here, it stimulates autophagy. Remember what I was saying earlier about the importance of autophagy. That's what we're seeing is really important. N-acetylcysteine, again, in this inhibits mucin synthesis and pro-inflammatory mediators in the alveoli. With the RSV virus, again, very similar. Our results indicate significant induction of these that is strongly inhibited by NAC, but again, it doesn't lower it to the point that the immune system can't do what it needs to do. It protects the cells and it allows the immune system to fight the viruses and not kill as many of our own epithelial cells. So let's talk about methylation. And this, it gets a little tricky when we're talking about methylation and viruses, because part of how viruses attack the cell is to take over your own methylation. And what ends up happening is it hijacks dihydrofolate reductase enzymes, and it stops folate methylation, and that's part of how it activates certain methyl genes, and it demethylates some groups and hypermethylates other groups. So I don't want to get too specific into this, but what we see is that hypomethylation, if you're undermethylating, that seems to be a very big risk factor, okay, for viral replication. Now you don't want to have too much methylation either, but it's kind of a tricky, where do you draw that line? We don't know yet. It's pretty new, but what we do know is that genetically, if your methyltransferases aren't working properly, you're more at risk. And if you don't have enough methyl groups, that causes global hypomethylation and local hypermethylation on the gene. So we want global methylation groups, folic acid or folate and methylfolate and methylcobalamin. But we want that, timing is important. So we want this before infections, not necessarily during. We want it right after. So again, it's kind of complicated, but having good methylation status is going into this prophylactically is really, really important. So, and we see evidence of this viral genomethylation as an epigenetic defense against certain viruses. I just wanted to mention it briefly because it's complicated, but it's really important. And molecular mechanisms, coronavirus, RNA capping, and methylation. So, again, making sure that your methylation, people who have elevated homocysteine, and indeed viruses tend to increase homocysteine, which is one of the reasons why we see this one having such a cardiovascular effect. And I'll get into some of the long-term effects in my future. I'll touch briefly on it, but what we're going to see some specific long-term effects from this, from people who have contracted it. So, vitamin, what's really important too, what we may see. So mothers can get this virus. Obviously, it doesn't seem to be transmitted down necessarily to newborns, to the fetus and newborns. But what happens is, getting an infection because of the inflammatory proteins and because of the immune system dysfunction and methylation responses, what ends up happening is we're seeing some teratogenic or epigenetic effects from this virus. So what that means is babies appear to be born okay from mothers who had the virus. However, we don't know what those long-term effects, what did that happen epigenetically? What we can do is just take what we know from other viruses, and specifically the influenza, because that's the closest to this that we're seeing. So in this study, during the pandemic influenza, women who were given B12 and folate had, their offspring had a better response. The mother had a better response, and infants had a better response if they were breastfeeding. So that's really, really important to keep in mind. And we know lupus. One of the things we're potentially going to see with this is, maybe activation of some autoimmune diseases. We know viral stimulation of the immune system causes long-term imbalances, or can cause long-term imbalances and trigger certain autoimmune activation. So we know that to be the case, and SAMe here is really important at preventing that immune system going into autoimmunity post-infection. So another this is an interesting study here, low SAM to SAW ratio. Okay, so S-adenosylmethionine to S-adenosylhomocysteine. If there's not enough adenosylmethionine, that ends up being associated with chronic kidney disease, pre or post infection. This virus does seem to attack the kidneys, or potentially, specifically because of the ACE ACE receptors. So having low SAMe status going into this is not a good thing, in my opinion. Homocysteine, B12, vitamin D, and neurocognitive performance. So we see that people with other viruses, we see the long-term effects of other viruses, and we have no reason to suspect that this is any different in that, because of how it changes the immune system and neuroinflammatory environment. And indeed, we're seeing that this virus may persist in certain tissues, not in an infectious way, but it can persist, perhaps through lifetime. We've seen that with other coronaviruses and SARS viruses, so we know it's possible. But again, having proper homocysteine, B12, vitamin D levels is really important moving forward post-infection. Another study, maternal influenza during pregnancy and risk of congenital abnormalities. So again, just another study showing how important it is for women to have proper methylation going into, if they do get to end up getting this. So methyl renew is really the other thing that's really important. I didn't have time to pull up a lot of studies on this one. I'll do it on the second part of this nutrition and viral immune. Sulforaphane is extremely powerful in decreasing the inflammatory damage due to respiratory viruses. So and that's why this one is one of the most important things that I've used in my practice. And we see we've got green tea, SAMe, curcumin, sulforaphane, and acetylcysteine that we've already talked about, and your methyl nutrients. So seems to be very effective, both in the literature and empirically with what I and some other practitioners that I've talked to have used. So one of the components that's in several products that NutriWest has is green tea. Green tea is one of the most studied, clinically studied antiviral nutrients that we have out there. So antiviral effects of catechins in green tea on influenza virus specifically, very good at inhibiting viral replication and also decreasing the damage done post-viral. So I thought this is an interesting study of it's so effective that the veterinary community, and this is back in late 90s, but the veterinary community, because we really, medicine doesn't have, traditional Western medicine doesn't have very good antivirals, and viruses can kill livestock just as easily, as humans, if not more so. So I like to learn from veterinary medicine, and because they'll use what works. They don't really have a pharmacological bias as much as human medicine does. So if it works, they're going to use it. If it's inexpensive and it works, they're going to use it. And so they use green and black tea, which is EG, CG, theaflavins and catechins. So and specifically against rotaviruses and coronaviruses. So it's fun to learn from veterinary medicine sometimes. That's actually how I, not to digress too much, but that's actually how I got into methylation, over 15 years ago. I had a dog who had problems with liver, and the vet said, put him on SAMe, and I started studying what SAMe was, and SAMe cured his liver. He had liver enzymes 4 times higher than normal because of blood pooling, and within a month his liver was healed just by putting him on SAMe. So that was in my last year of school, and that got me into the methylation and SAMe and stuff. So I love learning from veterinary medicine. In this study here, I like, healthcare workers are on the front line, and we're seeing news reports of how ill-equipped they are and how scared they are, but we have things that we can offer them, and this is just a smattering of things. I mean, there's a lot of Chinese medicine that's been studied, like andrographis and things, but in this randomized placebo-controlled trial, consumption of green tea extract reduced upper respiratory tract infections by healthcare workers by up to 50%. I mean, that's huge. So in the control group, 30%, almost 30%, the placebo group, 30% got the upper respiratory infection, whereas only 13 in the catechin group. So, so interesting that it can work. So Cordyceps here is also one of the most important. We're seeing cordycepin suppresses expression of, now and here it studied diabetes regulating genes, but we know diabetes is a huge risk factor right now. And why is that? Because of inflammation, because of systemic inflammation, because of redox incapability, because of the epigenetics, because of the ACE receptor, because of insulin resistance. So cordyceps can really help with all of those underlying factors. So cordycepin has been known to have many pharmacological activities, including immunological stimulating, anti-infective. It inhibits the production of too much NO, or inducible nitric oxide, and other pro-inflammatory proteins. So it's not going to stop normal production of these, but it's going to limit the activity so we don't go into too much damage. So it's a mediator, and that's what we want. Again, cordycepin suppress some of these NF-kappa B genes that stimulate inflammation and put diabetics more at risk for respiratory viruses and mortality and morbidity. So in this study as well, cordyceps increased hypoxia tolerance, so specifically to lung tissue. Now, this wasn't done in people with a viral infection, but it was done in normal people. But one of the mechanisms of action is it attenuates hypoxia from many different sources, high altitude or lung damage or COPD. So cordyceps specifically, and acetylcysteine and lipoic acid, which we'll get to, all of these things have very beneficial effects on lung capacity, lung antioxidant status, and specifically viral immune support. So really, really powerful stuff. And again, we have these studies. We have to use the best available evidence that we can. This is a great Frontiers in Microbiology, very well respected journal. It's one of my favorites. All the Frontiers journals are really good. This is a deep dive into antiviral agents from fungi. If you really want to deep dive into it and look at the phylum and the classes and the different mechanisms and different components, it's a great study. But the general idea of this article is that mushrooms and fungi represent probably the most powerful antivirals that we have, and they're not being used because of all the reasons we know why they're not being used, but they should be used because they're very powerful. They've been studied and they are available. So LV Renew has cordyceps. It's also got the green tea. It's got N-acetylcysteine. Milk thistle is very powerful at increasing glutathione levels in liver and lung tissue and brain tissue as well. So this is something that's good both prophylactically and post viral infection. It's something that I used a lot in my patients and use a lot of my patients with what's going around currently. So mushrooms, other mushrooms like Coriolis, lion's mane, reishi maitake. The neat thing, the interesting thing about mushrooms is they stimulate Th1, but they prevent overstimulation of Th1. And many studies show that, and this is just one, but cordyceps had the ability to restore a balance of Th1, yet prevented an overactive response. And this is where the whole Th1, Th2, Th17 thing, you really have to know the nuances. You don't want to avoid Th1 stimulating things. You want to use Th1 stimulating components like lentinin and the mushrooms that are known to not overactive or prevent overactive responses. There's some debate that some people with Crohn's disease and ulcerative colitis seem to be more at risk, not just because of the immunosuppressants that they may be on, but because of having more inflammatory illness. So that's all that will all be kind of hashed out in the post-investigation stuff. But we do see that this virus does persist in the stool, or can persist in the stool, and therefore create inflammatory responses in the gut and cause a cascade of cytokines and calprotectin potentially. And so, mushrooms have always been, I've always used them in my practice for ulcerative colitis and, for inflammatory bowel issues, and very effectively. So I believe it can be used quite effectively. And I have, several patients who are doing that right now. So really important to, Glycan Renew just has, we formulated it to have kind of the heavy hitters of what works for viral immune support, and especially the lentin in here. A lot of studies on the lentin and how important that is. Vitamin C, I'm going to just briefly, there's been a lot of reports, unless you live under a rock, probably read a bunch of reports on vitamin C. So I don't have too much to add to that, except that it does work. But a couple interesting studies, just specifically on what's going around now. And this was actually, used in China and Japan and other countries, and is being used right now. And again, it's this free radical and cytokine modulation that's really, really important. So if anyone's, this is just a little letter that and some good articles cited in this letter in the Medicine and Drug Discovery just recently, looking at actually randomized placebo-controlled trials and vitamin C trials in very severe acute respiratory distress syndrome patients. So vitamin C here can shorten the length of stay in the ICU. This was just published a couple weeks ago. So with what's going around now, just using vitamin C shortens the length of stay and can reduce mortality. Specifically vitamin C and SARS, so another really good study here. So again, I gave you my doses. 500 milligrams prophylactically 4 times a day, 3 to 4 times a day, and pretty much double that or more if some practitioners recommend 2 bowel tolerance. I'm not sure that that's totally needed. I haven't seen any studies on that. I think 3 grams orally was one that worked really well, and so that's kind of what I shoot for. Okay, so vitamin D, we also know about that. I don't have too much to add to that, but again, very important in both prophylactic and post-viral stuff. The goal should be to raise concentrations above 40 to 60 during this time, and that's kind of what we want. We don't need to go 100, we don't need to go that high. There is evidence that if you go too high too quickly, you can reduce immune responses. Okay, it can be immunosuppressive, very high doses, very acute doses. So I recommend 5,000 IUs a day, and maybe check the blood levels. If you can't get where you need to go with 5,000, you could do 10,000, but be careful. Don't do too much. Those of you who have heard me lecture before know what my opinion is on vitamin D. You need vitamin D, but most people are taking too much. And studies show that your optimal immune function is between 40 and 60. Okay, so just know that. Don't go overboard. Okay, so here's just some general immune support. The echinacea, olive leaf, elderberry, astragalus, methylation. I don't want to get into the cytokine storm. That's been kind of beat to death. It's really not been shown to be applicable in this case. So I haven't seen that. And but again, we have, if there's a way to use labs to actually look at who is more inflammatory, more inflamed, but we have so many other things that can help modulate that. Glutamine hasn't been talked about a lot. Glutamine is extremely, extremely important in this, in all viral support. We know one of the things that also increases risk for comorbidities here and perhaps mortality is worse disease progression and long-term damage is leaky gut. And in the next session I'll go more into that and some studies into that. But it just makes sense because 80% of our immune system, 70% of our immune system exists in the gut. And if the gut is being overwhelmed with inflammatory dietary proteins and lipopolysaccharides, you're already in a pre-inflamed state. You're already more likely to have Th1, Th2 imbalances. And glutamine not only protects gut tissue, but lung tissue specifically as well. And it helps restore redox balance. And Dr. Belgrau and Dr. Tui talked about the importance of probiotics. I'll get to lipoic acid and grapeseed here, which is a really powerful combination here. But just some general things. I do use andrographis a lot as well. Andrographis has been shown to be very effective against specifically respiratory viruses. Thymus, we don't necessarily think about thymus in this, and I think it's one of the reasons why younger people seem to be more protected. Thymus is really important in obviously T cell functioning. And so the thymus, I think it's the thymus glandular from NutriWest we use a lot, and I think it's really important in supporting the overall immune system for viruses. Zinc, again, everyone knows how important zinc is. I guess the one thing, zinc helps increase thymus levels, and we know that zinc levels decrease dramatically in humans as you get older, so it is important. Here's calf thymus extract that I was just mentioning, how important that is and can be. So these are the things, the Thymolife and some other of the nutrients I've already mentioned that can support the thymus, decrease your stress and chemicals and all that stuff. So I guess the dosing part of zinc, in my opinion, you need to be careful because you can get too much. Zinc only has its best effect on the immune system for about a week or two. After that, its effect dramatically decreases, and there's really no point in continuing to take it after a week or two. So, or I should say in high doses. So it's important to have good zinc levels at all times and making sure you're not deficient, which, at least, I would recommend 20, 25, a day, and then milligrams a day. And then during this time, you can do 50, a day, but not more than maybe a month. But if you go to 100 milligrams, you should only do that for about 3 or 4 days and then go back down to 50. So you can get too much zinc. So just be careful about that. And I think a lot of people are going to get too much zinc in this because I've seen people on the internet, touting massive doses of zinc. And zinc can be extremely toxic and very dangerous to the immune system if you take too much. So please be cautious about that. Be prudent and don't take massive doses for long. Truly, studies only show its greatest benefit for the first week or two in taking higher than normal doses. So let's get into grapeseed extract. So grapeseed extract is been shown to have a great effect on the immune system, specifically viral immune system, and its antiviral capabilities directly. So flavonoids manifest, and this is one of my favorite flavonoids, as you know. Flavonoids manifest a diverse range of biological activities, and it's very balancing for the Th1 and Th2, and specifically, this study shows that grapeseed extract reduces viral transcription. So and its effect on the cytokine. So really powerful studies that we have. Pre-treatment in this study with the grapeseed extract downregulates the pro-inflammatory cytokine expression in airway epithelial cells infected with RSV. So again, pre-treatment, having some in your system and having a good inflammatory balance and cytokine balance in your system is really, really important. After the fact, we can do a lot, but pre is really important as well. So the expression of interleukin 1 beta, interleukin 6, interleukin 8, they all help decrease the RNA, messenger RNA and protein expression levels. Again, it reduced levels that were too high. It didn't stop it from being made and allowing the Th1 cells to do what they need to do, because these are all Th1 stimulating cells. So it stimulates the Th1 cells without going into overstimulation. And resveratrol, which grapeseed extract, a lot of people don't realize resveratrol is in grapeseed extract. So there's a lot of resveratrol in grapeseed extract because it's a component of grapeseed extract. So, but resveratrol also is very, very effective and very, very helpful for immune support, especially respiratory stuff. So resveratrol and grapeseed extract and another study here showing specifically how it decreases the viral replication and supports lung tissue. And together with grapeseed extract and lipoic acid, it seems to be a really powerful combination. In this study here, sorry, it's really small, but biochemical and clinical relevance of alpha lipoic acid, its antioxidant and anti-inflammatory activity. Really good study just going into how it works, specifically for lung tissue and mitochondrial and autophagy, things that we've already talked about today. And it's been studied against other viruses too. Again, I'm not saying that just because it works with one virus, it works with all viruses, but we do see the underlying mechanism of action works with all viruses. So, so very interesting, very supportive, heart, pancreas, lung. And again, this particular virus, really affects cardiovascular tissue, lung tissue, and a heart too. Actually, a lot of people are experiencing arrhythmias as their first sign of infection. So it's kind of interesting. I read that in a cardiology journal. So one of the things that lipoic acid does is it increases total glutathione status in lymphocytes specifically. So it allows lymphocytes to be more effective at what they're trying to do. And also it's been shown to be effective against acute lung injury, against many different types of acute lung injury, which this is a type of this current pandemic is a type of acute lung injury. So grapeseed extract and lipoic acid, taurine and magnesium, also very helpful for cardiovascular tissue. Taurine and magnesium also modulates the ACE receptors, so it can be helpful with modulating the ACE receptors, and so that's something that I've used a lot and continue to use with my current patients. So I just want to touch base. We're almost done here for today. Just want to touch base on some of the long-term implications that we won't really know, but we have a lot of clues based on similar viruses and things. But we are going to see some neurological in some people. Like I mentioned, if you're methylation deficient pre and post, then you're more likely to have neurological. If you're glutathione deficient, you're more likely to have pulmonary. If you're elevated homocysteine going into this and you get infected, you're more likely to have long-term cardiovascular. But all of these can be attenuated. All of these, with the research that I've presented today and the research that we know, based on how we treat these things long-term and the infection connection between chronic degenerative diseases. So again, it's important to look at these things long-term. I'll go more into long-term implications in my lecture coming up in May here, and we'll get to that in a second. But maternal exposure, again, to viruses I'm not saying this is, we don't know yet, but I'm saying that based on past experiences, we know that it can perhaps affect the heart of the fetus. So we're gonna have to wait and see till the data comes in, years later. But I think it's a good chance, and I think it's worth perhaps taking some preventative measures if they're, again, very simple, very inexpensive, and very low side effects, like the things we've talked about today. Another thing I wanted to bring up, because this is what I've talked about in my functional medicine series and my functional medicine certification course, is just how we're seeing now a massive amount of chemical influx into our world. So one of the post-viral, post-pandemic things we're going to have to deal with is the massive amounts of disinfectant use that people have been using. And we're seeing that now getting into our water supply because it does not get removed from municipal water plants. And of course, health workers are getting exposed to these things. N95 masks do nothing against disinfectant. It goes right through. And so we see in these healthcare workers specifically, and quaternary ammonium compounds, that's what's in Lysol and things that they're using, glutaraldehydes, all of these are being used in hospitals, and it increases significantly the healthcare workers' risk of COPD. So again, one of the things that we can do to help support our workers is to educate them on this and to make sure that they wash their hands, they don't get, they try not to breathe it in, and that their antioxidant status, their glutathione and acetylcysteine status is up to where it should be to prevent the damage, long-term damage and sequestration of these chemicals in the body. Another one we're going to have to deal with is how these massive amounts of disinfectant chemicals are going to affect our young. We know that chemicals affect our young, and this one just came out recently, just again showing that these disinfectants are endocrine disruptors. We know they're endocrine disruptors, and so we're gonna, we just need to be aware of that, and I'll go more into that in my lectures. And one of the last things I want to talk about is disinfection of N95 respirators and masks. One of the things you can do is just use, in this study, they just used hydrogen peroxide. So it has to be at least a 7% or 8% solution. At least that's what they use. I don't know if lower would work. But if you have some food grade hydrogen peroxide, then dilute it to about a 10% dilution, and then you can spray the mask, let it sit overnight, and that seems to be effective. So one of the things that we could be doing very simply, very cheaply in our hospitals to prevent PPE equipment from being in short supply. So that's what we have for today, and I just wanted to discuss a few things. I am still doing, for those of you that have asked me, I am still doing my 4-course series. We're going to obviously do it online. So if you want to register, you can either call Corey or NutriWest for Life here. You can call or email, or you can email me as well, and we'll make sure you get on the list. We're going to be doing Module 2 here fairly soon. So those of you who went to Module 1, we are going to continue, and we'll do it online. And I can't, we're looking at CE credits and all that stuff. So states are going to have to change their CE requirements and allow more online, I think. So just be on the lookout for that. Make sure you've emailed me or a NutriWest for Life or someone in NutriWest, your distributor, and we'll let you know when that is. Also, my courses are online. All 6 modules are online at drbrandonlundell.com. And if you email me, I'll give you a $500 off code. Just mention NutriWest, that you heard this through NutriWest, and I'll give you a $500 off code. Also, if you go through your distributor, which we'll talk about in a second, if you go through your distributor, you actually get a credit for product. So we'll talk about that in a second. But it's a 6 module for those of you who haven't taken it, and you can get certified at the end. You take all 6 modules. Each module is about 12 to 15 hours, and it's step by step. And you can email me, and I can help you go through it. People seem to have a little bit more time on their hands, although I thought I would, and I don't for some reason. Days seem to go by just as fast, but I cover functional medicine from A to Z, okay, including viral nutrition, including autoimmune. We talk about lab work and blood work and mitochondriopathy. I mean, we go through everything, detox and hormones and immune system function in depth and methylation. We cover everything that a functional medicine practitioner needs to be very good at what they do. So the download cost, if you go directly to my website, is $29.95. But again, if you email me, I'll give you $500 off. And when you complete the course, if you go through your distributor, then you get a 50% off your NutriWest purchase up to $1,000. That's another $500 off. So we want to make this really, I mean, it's already really affordable. There's no functional medicine course out there that covers the depth that I do for this amount of money. Most of them are far more expensive. So I hope people take advantage of it. So contact your distributor for more information. Right now, for 2020, NutriWest has plans to offer all their seminars through virtual broadcasting until it opens up. Well, we won't know when that is. It's certainly not going to be May 16th, my next one, or it's going to be held here in Denver. But sign up through NutriWest and Functional Health Home Runs. I'm going to go through a lot of viral. I'm going to sort of switch into environmental and viral immunity. I have a lot more to share than I did in this 1 hour, although we covered a lot of ground in this 1 hour. So I'm glad people paid attention. So that's it. I will answer questions and maybe go over that in the next, maybe I'll do another module or I will do another webinar here, and we'll go over some of the questions because we have some questions. Now, I will answer a few. And someone asked about the heat issue, and yeah, so there's 2 other things that I recommend that have been shown to be effective for all viruses. One is an air purifier, and those of you that have been to my lectures or know anything about what I recommend, the Healthway air purifier that I use. I have nothing to do with the company, but it's the one that I've researched the most. It's called Healthways, and yes, it kills the virus. Many air purifiers do, so whatever you have is good. So making sure your air is clean. So this virus, obviously having a fatty acid encapsulation, does seem to be heat sensitive. That's the good news. We don't know how heat sensitive, but like most viruses, it is heat sensitive. Humidity is also something that it likes. So dry heat is extremely important. So infrared sauna is something that I would employ and have employed for the patients who have had it, and it seems to be well tolerated, and again, it's helped my patients. The average time of symptom to recovery in my patients is about 7 days using these things that I've used, and these are positive cases. I am doing testing in my office. I'm doing both the PCR testing for acute and also antibody testing. So if anyone wants information on the antibody tests, and if they want to get it, or if they're here, we can either send you the kit, or but you can contact my office, or just go to my website, drbrandonlundell.com, drbrandonlundell.com. But yes, so I do suspect that we will get a lull in the summertime for many different reasons, right? Vitamin D, people are outside more, they're not cooped up inside. I mean, but this is heat sensitive. We do know that, and so it doesn't have to be 110 degrees, which was the question. Actually, anything above 100 degrees, anything above 80, I think, is some studies that I've shown decreases it quite quickly. So droplets in air over 85 degrees, the half-life of a virus is less than 30 minutes. So yeah, that can be very helpful. And we won't know until we get there. But let's see. Yeah. So back to the glove and mask thing. So nothing is perfect, but anything you can do is good. The gloves do help. Not touching your face. Yeah, I mean, my opinion is that I have seen it. Healthcare workers who practice good but, PPE, hygiene, are at much less risk. So yes, that's what I do in my office as well. And it seems to be helpful. So lab testing that I use for DHEA, the lab test that I use right now, the easiest is saliva. But any lab, you can do blood. I've switched to doing phlebotomy in my office. I would send the people out, but because I'm doing the antibody testing, which is blood, and it's very difficult to get in these days to lab draw stations. It's not impossible, but I'm just drawing blood in my office now. But yes, so you can I use LabCorp or Professional Co-op, which uses LabCorp for blood, or you can do saliva. And you can use Labrix, you can use any of the saliva testing, and they will do DHEA and also look at your other hormones, because like hopefully you got from today, it's not just DHEA, it's all your other hormones as well. And the dosage of the DHEA and melatonin in the study, I think I gave those. Maybe I didn't give them DHEA. I think I gave the melatonin, but the DHEA for an average person is about 25 milligrams a day. The older you are, I think maybe the more you can use, 50 milligrams. I think they used something like 2.5. The highest they went was 2.5 milligrams per kilogram. But yes, that's some of the dosages that I've used. So, all right. Yes, what I'm using in my office, somebody asked this, is I'm using hydrogen peroxide because it's safe, it's effective, and it's non-toxic. So I use a 10% hydrogen peroxide. Actually, it's probably more like 15%. What you do is you spray it down, and you can Google food grade hydrogen peroxide. I think I get mine from Guardian of Eden or something like that. But you can get food grade hydrogen peroxide, and then you put it in a spray bottle. Usually food grade hydrogen peroxide comes to you at 35%. You do not want to use 35%. You will eat your fabric. It's very, very caustic, so you got to reduce it to about 10%. And that's what I use, and I do spray my masks with that at the end of the day, and so far it seems to be working. So, all right, everybody. Well, thank you for joining us. That's what we have for today. We'll do it again, and everyone stay safe, stay healthy, and we're gonna get through this. I'm very optimistic about where things are going to be. I think there's a lot of positive things about increasing awareness of health and viral immunity, and everyone's way more aware that, geez, if you're healthier, you're just not going to succumb to this as often. So everybody be safe. Thanks for joining us today, and we'll see you next time.
Yeah, thanks for joining us, everyone. And don't forget to call and register for Dr. Lundell's seminar, Functional Medicine Home Runs, on May 16th. So call the CCA organization, or you can call me. The number's right on the screen there. The number's 303-662-9997. You can also call toll-free if you're outside of the 303 area code, 866-271-8888. And until next time, thanks, folks. Stay safe and well, and we'll see you soon. Bye now.